So I presented in Prague in the last workshop our researches on sexual behavior in the Czech Republic, and we had 5 waves of representative survey in the Czech Republic, and I will try to, from 93 to 2013. It was financed by the Ministry of Health, then by pharma firms, Pfizer and Berlin Chemie. And we had about 2,000 respondents, 1,000 men, 1,000 women. And the samples were representative for the Czech population, and it was paper pencil method, and with very high return rate, about 80% in first turns. Now we have problems with no financial support after the last 5 years in 2018. It is a question, what is better, random or quota sample? And I think everywhere is a big problem, and a decreased return rate in such researches. Here we have the types of our questions and encoding of the questions, 3 types of possibilities, as you see, and some interesting results. The first decrease of the age at first intercourse, but the increased use of contraception. First, you see it is no contraception at the first intercourse, and condom is increasing. It's men and it's in women too. Number of sexual partners is quite stable and quite high, about 10 in men and about 6 in women. In the last 12 months, the number of partners is not very changing. It is quite stable. And use of contraception in men, especially the condom use, is higher than it used to be, and hormonal contraception for the female partners is the same in women with hormonal contraception. And sexual dysfunctions are also quite stable, about 13% in men and about 11% in women. Sexual abuse in the childhood we found in 2% of men and in 4% in Czech women. And we ask also men if they committed any sexual violence, and 5% of Czech men, you see, really admitted that they raped a woman. Raped women are about 10% in the Czech population, and most frequent perpetrator of the rape was husband or the stable partner. The completely unknown men were only in the last 2018 turn was only 3%. Sexual satisfaction in the Czech men and women is quite high, as you see. Fully unsatisfied sexually is only 4% of respondents, and fully satisfied about 1/3. And what is the further development? What projects is planned for period of 21-23? We haven't representative data on the current sexual health and behaviors, but we have some promising research projects which conduct basic research of recent phenomena related to sexuality, such as online sexual behavior, the use of dating applications, cyber sex, cyber grooming in young cohorts, and also sexuality or relationships in the older adults. And the aim of the proposed project is follow up this interrupted series of national surveys, and it is taking it up 1 decade after the last survey held in 2013, and we hope it will provide data about longitudinal trends and new sex-related phenomena. The questionnaire will be developed and will take into consideration items used in previous surveys to allow this comparison of results. Moreover, the questionnaire will be developed in collaboration with members of WHO Working Group, Department of Reproductive Health and Research, and of the World Observatory of Sexual Health, especially with Petr, to accommodate the recently developed standards and to enable inclusion of the Czech data into cross-country comparison in future statistics and projects focused on sexual health and behavior. For the purpose of this planned study, we will interview a representative sample of Czech men and women age 18 and above, and we hope we will get about 4,000 participants, and this will be representative and recruited from by a socio-demographic agency using computer assistance and also personal interviewing with a self-completion component. The sampling method will be based on a random sampling with respect to age, sex, education region of the Czech Republic and size of the place of residence. Quotas will be determined based on the last census of the Czech Statistical Agency. And general recommended domains and suggested for included areas and examples of the good practice are provided below. Characteristic of participants and their health status, social norms around sex and attitudes towards sexuality, sexual relationship history, sexual behavior and practices, sexual functioning, reproductive history, experience with non-consensual sex and online sexual behavior. The research group is involved in long-term international collaboration with several leading organizations in the field, including the WHO Department of Reproductive Health and Research, group of the European Sexual Medicine Network, and the World Observatory of Sexual Health of the Weiss. Thank you for your attention.